Thinking about popping pills on your health? Wondering if pharmacy was designed to make you sick or to build health and in turn wealth? Pause. Think about it with intentional thought and consider where we go from here. Listen intently as Dr. Marvin Smith shares how pharmacies can move from the dispensary to the center of nation building. Tonight, we explore how pharmacy protects people, strengthens systems, creates opportunities, and can help catapult our nation towards a healthier, more resilient, new-built environment. This is something to think about with Dale Happy Knowles.
Something to think about with Dale Happy Knowles. What we think, we become. What we radiate, we attract. What we imagine, we surely can achieve. Let's change the narrative 242.
Welcome, welcome, welcome. Where'd my picture go?
I don't see you in the picture, but it's good to be here.
Right. Boy, Murphy got his way. Murphy got his way, man. All that good talking we was doing a while ago, and all of a sudden, you want to come here and try it.
Man makes plans and God laughs. But it's good to be here. It's good to be here, my brother.
Good man, good man. Yeah, there's something to think about. You know, how Murphy always getting in his way. But you know, I always say that it all starts inside the 6 inches between our ears, and we will make it work. Pass all obstacles, conquer them, because that's what the good Lord instilled in us, to be leaders, to achieve what other people will just sacrifice and give up.
That's right.
We're talking a little bit about that as we move forward. So, folks, this evening joining us tonight is a man whose work has quietly shaped how pharmacy serves this nation. Dr. Marvin Smith. You see the R in the front there. They got plenty power in that R, right? Is an energetic doctor of pharmacy trained at Mercer University in Atlanta and a leader who has served as chief pharmacist for every public hospital in the Bahamas. He currently serves as the director of the Public Hospital Authority and is president of the Bahamas Pharmaceutical Association, now in his second term, misery-like company, after previously leading the association and serving as president of the Caribbean Association of Pharmacists. Man, you stretch thin. So Dr. Smith, and I can call him Dr. Smith too much, also brings an academic and mentorship lens as a member of the Dean's Advisory Board at Mercer University College of Pharmacy and Health Sciences. Man, you some powerful stuff here. And continues to help shape the profession through regional and institutional leadership. And a host more, but I ain't gonna read none of that. So tonight, he joins us to help us rethink pharmacy, not just from service, but as a strategic pillar in public health, economic resilience, and nation building. Welcome, Dr. Smith.
Welcome, my good brother. It's good to be here. I got some breaking news that's being told for the first time ever on this show.
You ran for politics?
No, I've just been confirmed as the next executive director for the Caribbean Association of Pharmacists, starting on April 1st.
Bam! Bigger than boom. Man, listen, you know, that means you're going to have to follow Mandela, right? Next, you can be doing minister. No.
I don't follow Mandela. Mandela went to jail.
No.
Tried to stay out of him.
Everybody be following you. Yeah. Cool.
It's just another
That's
avenue for service. That's it.
Yes, yes, yes. Big time. Service above self.
Yeah.
And all those good things. So, Doc, how was your day?
You know, typical day. Came into work. Between that, working with the association, dealing with some business on that end, dealing with some documents for our upcoming newly formed pharmacy union. Had a meeting to deal with some Masonic stuff. Had a meeting with my church crew to deal with some church music stuff for the weekend. Just got off a meeting with the Caribbean Association where the aforementioned announcement we just talked about, and now I'm here with you. So
right. So 24 hours. We were just talking about 24 hours in the day.
A typical day for me.
Mm-hmm.
So typical day.
People be talking about they tired by the time as they leave work. The minute they leave work, they're tired. Right. And I think that's a mental thing.
Well, like I told you before, my mantra has always been squeeze every bit of energy you can out of every second of every day. So whether you decide to rest, make sure you rest properly. Whether you decide to work, you work properly. When you decide to play, you play properly. When you decide to chill, which could be a mixture of all of those, whatever you do, make sure you're maximizing it. I don't believe in wasting time. I was telling you earlier, in my car, my rest is I'm listening to the radio. If I got a meeting to do, I'm taking my documents and I put those on audio notes, and I'm on the way to the meeting, and that audio notes is playing, streaming through my car radio. If I'm learning Masonic lectures, I got that, or the rituals, that's on my phone. If I'm getting ready for choir practice later on in the week, I got the music moving. I don't waste time. I just don't. So, and that helps me to really take on a lot of stuff and get it done.
Right. Yeah. So that's a nugget number one, people out there. And welcome to Something to Think About, folks. You're welcome to ask questions in the chat, and we'll endeavor to answer them, or Doc will endeavor to answer them, because I'm no pharmacist. So, again, I want to speak to that. Cool. So, Doc, you know, Something to Think About is all about trying to expand and build the people and our nation and so forth. And so, one of the things that we talk about is the new built environment, which we talk here is the political and economic social environment for our society formulated through intentional thought and action, right? And people know the rest of that. But basically, we are strong in this intentional thought and action. But when I think of pharmacists and pharmacy, I think that pharmacy ain't just about pills. It's about people, protection, and possibility. When we understand that, we stop treating health as a cost and start seeing it as a national investment. What's your thoughts on that?
You know, if you go back to your other slide that talks about what...
No, where you?
Not just in this country, but I can tell you across the region and across the world, is that we want to build this new environment. And just like how you have it read here, where it's the political, then economic, then social environment, that's the hierarchy in our heads that we look at it. We think that everything we need to do has to first have a political approval or political support. And really, truthfully, politics is supposed to be a reflection of your social and economic environments, not the other way around, right? Politics should really be the symptom of what is occurring through your economic and social health. And the problem is we've mixed that up. And so we've built a country in which people think that being a politician is aspiring to something good, or even great. When the truth of the matter is, the real definition of what a politician should be doing in governance is no different than a waiter in a restaurant, right? You go in, and the person that, yes, you want to tip your waiter for good service, but who really decides whether you get into a restaurant?
It should be the people.
It's the chef. It's the food. It's the service. It's the ambience. It's all of these things. right? You don't treat the waiter like he's cooking the meal, all right? And at the end of the day, we have to understand that we have to be the chefs in our own restaurants of life.
Mm-hmm.
We have to be our own managers. And what we're asking for our politicians to do is, hey, I'm going to create this good product. I need to make sure now that you serve it properly to the people who have to enjoy it.
Mm-hmm.
All right? And so the politics of it has to come really as a secondary thing down the road. But we do it the opposite way. Every day you turn on the news and 9 times out of 10, your first story is about something political.
Yeah.
You turn on the radio, it's political. Okay? I listened to the radio today and people spent more time talking about Fred Mitchell and Adrian White over some of the stupidest stuff.
Yeah.
Okay? I mean, please. That's some back of the schoolyard, junior high stuff these guys were throwing around.
Junior high? Man, primary.
Well, I mean, I don't expect primary school children to know what they should or shouldn't do with a woman and who should be married and who shouldn't. So I can say junior high. Okay? I'm giving them a little bit of the credit. Why is that important? What we should simply say is both of these idiots acted like idiots, and we're not going to give the idiotic things that either of them said any kind of coverage. Well, let's move on and see what really needs to happen.
Yeah. So all that is a part of the mindset that we need to change in our society,
Exactly.
right? And so for this new built environment, basically, the politics, economic, and social, it's just the pillars. And from some think about point of view, we don't have any of them. It might be listed, that's the first, but it's not
Right.
priority
And
over
I
another.
know that.
And the politics is
You know,
really governance.
Our collective mentality in the country,
Mhm.
that's what most people do. The irony of this, and I'll say this to you, okay? You talk about pharmacy and healthcare
Right.
should be looked at as an investment and not a cost. All right?
Mm-hmm.
But more people care about which Valley group they're going to support in a week
Mm-hmm.
than they do about what governments are doing, what the private sector is doing, what are all these factors that shape the actual cost of healthcare and why it isn't being treated as a national investment. And one of the things that we've tried to do in the association over these last couple of years and throughout the region under my leadership was to really drill home that your healthcare is your healthcare. And you need to take ownership of it. That was our theme, empowering your healthcare journey, right? And making people understand that if you take everything that's happening with your healthcare and look at it from the lens of I'm on this journey. I want to get from this place to that place. I want to get from a developing child to a healthy adult to a well-maintained senior.
Mm-hmm.
That's the journey, right? How do I do that? And when we start looking at those things, then we can talk about things like changes in diet and exercise and reducing the sedentary lifestyle and how we manage poor habits, how we eliminate bad habits, how we stay away from dangerous habits. We then look at channeling everything we hear from those who are in governance to us through the lens of how does this help me in my journey, rather than how much it's going to cost, or can I get it for free? All right, or even holding people accountable. All right, when we look at the fact that it is 2025, about to be 2026.
Yeah.
We started to revamp and rebuild an emergency room at the Princess Margaret Hospital in 2018.
Yeah.
It's still not open.
Yep.
Okay. They broke ground for a new clinic on Blue Hill Road 7 weeks ago.
Yep.
And they're getting ready to put a roof on.
Yep. Mm-hmm.
What does that tell me? That tells me that when you want to do something, it can get done.
Yeah. Yep. It's always been that way.
All right. So what that means is if I'm treating governance as the waiter in my restaurant, I need to say to them, hey, I understand you busy taking out bread and butter to these tables, but I got some entrees. I got some $80 steaks in the back here getting cold.
Right.
All right. Because these are the things you have to look at. And we have to drive that home to people. It's not a political thing. It's not I like this one, I don't like this one. It is, how are we creating a Bahamas that's healthy? How are we creating a Bahamas that's sustainable? And more importantly, how are we creating a Bahamas that provides an opportunity for sectors like healthcare to be both profitable while still being plausible for the population?
So my view on that is that we're still going through a journey of finding our true identity, right? So we were colonials and now we're independent and we're still rolling over, rustling in the hay, trying to figure out if we find out that needle in the haystack to figure out who we are.
Are we independent?
No, you're never independent, right? You have dependency, you have independency, and then you have interdependency. So
I would proffer to you that we're not even interdependent. I'll put it to you in this example, right? I know one of your kids. I know your son, right?
Yeah.
All right.
The oldest one, yeah.
If he wants to be truly independent of his father, that doesn't mean that he doesn't come to you for advice or those sort of things. That's an interdependency. That's good. But if he's still living in your house and you still paying his car note, and he got to come to you for an allowance every month because he can't cover his bills, he's your dependent. That's what the law says.
Yeah, no, from that perspective,
the
yeah.
literal definition.
Okay, so those things doesn't necessarily mean that he, as an individual, isn't. That just means that based on the system and the circumstances that he's in at this present point in time, he's not able to do that. And part of that goes right back to this Immovable Properties Act, which we took away and caused the disparity between salaries and ability to buy property, and properties become too high, and the cost of living now is the spin-off of that is too high compared to what the natives can't even maintain themselves in their own country.
Well,
right?
it's not just the Immovable Properties Act that's the issue.
No, I'm just giving an example.
And I've said this before on multiple platforms. I make no excuse for it. All right. Every politician, every parliamentarian who voted to repeal the Immovable Properties Act should be jailed for treason. Should be jailed for treason. Absolutely. It is the most treasonous act committed against the Bahamian people ever. And I don't care who voted for it. If you voted for it, you should be in jail. Okay? Because what you did was you literally ripped away the possibility and the capability of the overwhelming amount of Bahamians to be able to do what our parents and grandparents could have done. All right? Because you set us up on a playing field that's not uneven. I'll give you this example. If I want to buy a piece of property for $200,000,
right?
Okay, in this country, all right, the bank is going to ask me to bring to them $50,000 minimum.
Yeah.
Okay, then they're going to give me a loan at an interest rate that's double digits. All right. And depending on, if I'm 25, they might give me a 25 to 30-year mortgage. But if I'm 35 or 45, I'm not getting that. All right.
Yeah. So
same way. But if I sit as Marvin Smith from Atlanta, Georgia, my government will allow me to go out and take that same amount of property or collateral that I have in the Bahamas now.
Yeah.
Okay. go to Bank of America or whoever else, all right, and get that same loan for 4.5%.
Yeah.
Right.
And pay a
But
premium.
my country won't allow me as a citizen to take my collateral and go and do it.
Yeah,
So
and that's
you
why I
see
said
that-
there's a mindset change that has to happen, and we're still going through the journey of that. So let's tie it into health, because you have mental health, physical health, etc. And so all of these things connect together in terms of what it's going to cause us to be able to generate and create this new built environment where we have sustainability for generations to come, like we used to. When we used to actually, people frown on the fact that we used to be, what they say, a fishing village of sorts, but we have how many thousands of square miles of ocean, and only like
why
5 or
wouldn't we be a
8,000 of land. So where's the money can come from? The ocean. I'm sorry that I never learned the sea growing up, because I think that's where we really should be looking, and that's one of the pillars of the new built environment. We have sun, sand, sea, digital, and people, right? And not sun, sand, and sea as to what the tourists are looking at sun, sand, and sea for, but as industries in there, right? And so forth. So when we look at all that, then when you think of a pharmacist, and this is a question to the audience, but you can answer it also to help them out. Do you see a dispenser of medicine or frontline health professional with the power to shape community well-being, and why? How do you think people look at you when they see you?
I think people have looked at pharmacists in this country through two lenses. Everything that we have read and we've seen and we've experienced tells us that, one, pharmacists are very respected in their communities. And in a lot of communities, they have been, the nurse. They've had to run a clinic of sorts, particularly on some of these, on our rural areas where we have pharmacies. But they're trusted. People know that they can come into the pharmacy and they can tell you the worst thing that's happened to them, and they're going to get some help.
Right.
All right. And I think that's the general ethos that people have for our profession. I also think that in a lot of ways they've pigeonholed what we do, because they've associated what it is we do with a product. And I say this to my pharmacists all the time. If the most important thing you give to your patient, I don't call them customers, I call them patients. The most important thing you give to your patients is a product, then you are not practicing real pharmacy.
Yep.
The most important thing you can give to your patients is the confidence, all right, that when they leave from you, they're going to be better than when they came.
Right.
Okay? That's the key thing about it. That's the first thing about it. Second thing is, why? Because you've given them information to empower that health journey. And then if they need some product to go along with that information, you've given them the right product. But they should walk away feeling confident. Just as confident when they come in there. If you say to them, you don't need a medicine. If you just go home and drink some water and do this or do that, or adjust this with exercise or diet, whatever else, you'll be fine. They should feel just as confident when they walk out of your store without a medication than they do if they walk out with one. All right. And so we're not just a frontline health professional. We're also the back line. We're really the person that ties it all in, because people will go to different physicians, but they like to come to one pharmacist. And so if they're being prescribed 2 different drugs for the same thing by 2 different doctors, we're the ones that see it. All right. If they're coming back over and over again and their dosage isn't changing, but we can see that they're not getting better, we're the ones that are seeing it, because we're seeing them every month. Whereas sometimes they're not being seen by the physician, but every 3 months or sometimes even 6 months.
Right.
So we're that key ingredient in the healthcare team that gets to experience the patient in what I call their truest sense. All right, patients go to the doctor scared, and it's crazy. They ain't feeling good, but when they get to the doctor, they want to act healthy, right?
Oh, everything become normal, like nothing.
Right.
It's
Right.
happening. Like,
But then they come to us and tell us everything, and they tell us
Mhm.
stuff they don't even tell the physicians.
Yep.
All right.
Yep.
And so we have to look at how pharmacists are doing that and empowering people with knowledge. That's the key thing. All right. It's been, I mean, one of the things that I think is critical that we have to look at is, again, if I treat my patient like an investment in my practice,
Right.
all right, I want them to be healthy. Healthy people live long. The longer they live, the more they come in the shop. If they don't buy medicine for me because they're sick, they're gonna buy vitamins for me to stay well, right? They're
Mhm.
gonna come in and if every time they leave me they feel good. People shop with their feeling.
Yep. Yep.
Okay, if every time they leave me they feel good, they're gonna find a reason to come back, and they're gonna
They can
find something
find
to
a
buy.
reason, but they also, the medicine will work for them.
Yeah.
Whatever the medicine, whether it's words or it's a product or whatever it is, will work for them if they feel the confidence in you.
Yeah.
Because then the mind takes charge.
Mm.
Whereas if they feel if they go into a doctor or like a dentist or somebody, oh, they're scared of the drill or the doctor with the needle or whatever, then automatically they can go in a fight or flight type of
Oh, yeah.
env-
I,
atmosphere.
Dale, I have
Yeah.
patients that I met in Grand Bahama when I was chief pharmacist.
Mm-hmm.
Now I left Grand Bahama in 2003.
Wow.
Okay, but I have patients to this day. One just called me last week, and they see some of the most premier doctors in this country.
Mm-hmm.
Okay, and they call me, Dr. So and so wrote this for me. You need to look at this. I ain't feeling this until you look at this.
Mm-hmm.
All right, why?
Mm-hmm.
Because my interaction with them has given them a confidence.
Right.
And so they go and they say, hey, that heart surgeon or that cardiologist or whoever else, he could write me anything you want. Doc, I ain't taking it until you look at it and review it.
Right. Right.
Okay, now I said to them, Mom, that fella's, you know what he's doing? Nope, you got to look at this.
Mm-hmm.
And that's the relationship you want to have. You know?
And that there right there, folks, is a nugget that spans across all the spectrum of
Yep.
work and customer relations and interaction and stuff like that. It's not just for pharmacists. Build your relationships with the people. That's key. So, Doc, if better access to pharmaceutical care leads to a healthier workforce, should pharmacy be treated as an economic development tool or not just a healthcare service?
I'll take that even further. Healthcare should be treated as an economic development tool. We grew up before we had 75 million channels and streaming and everything else. We grew up, if you was lucky, you had one 12-inch black and white TV and all you had was that mess.
And somebody
Right?
outside shouting, to the left, to the left, to the right, to
And
the
you
right.
would hear every time that this began, the health of a nation is the wealth of a nation. Right? It's like we don't believe that no more. And so we literally allow people to import crap food in here instead of growing the things that we do. We're importing in coconut water from Thailand with preservatives in it when we have entire islands that have thousands and hundreds of thousands of acres of coconuts.
Yeah.
Right? Why would you do that? Now, keep in mind, we're importing it in because there's a demand for it. Ain't nobody sending coconut water from Thailand because to the Bahamas because they just feel like sending something to the Bahamas. They've done their market research and realized this stuff sells. So we know it makes money.
Yeah.
Right? Why would we bring something in, preservatives in these rusty cans, when we can make it here? All right? That's healthcare, but that's also an economic development tool. If people are healthier, they have less reason to miss work. They're better at their jobs. They're more productive in their jobs. All right? All of these things are critical. And so we have to get past this thing where we, the government has gave you free service. All right?
And free.
Well, it's not free. And two, think about how people utilize that. 90% of the people who utilize the government services do so through A&E. They only come when there's a problem, right? What if instead of focusing so hard on giving out free medicine and free, you only got to pay $10 to register to A&E. What if we took that same money and resources and said, how about health education? How about starting healthy diets and healthy habits in our government schools, making it a part of the national curriculum,
right?
Mandating that for every vending machine you have that does this, you have to have a certain amount of this. All right. These are the key things you have to be able to do. All right. And we did this in PMH back in 2017. We said, we're going to take out the sodas out of the machines and we're going to put juices in, we're going to put nuts, and we're going to put some other things. We kept a couple of the candies and chocolate bars, but we took out a bunch of the heavy stuff. And you know what? I asked the guy, because I would be working at the pharmacy late when the guy would come in 11:30, 12 o'clock at night to refill them. I'd see him walking out and I'd say, has your business gone down any? He'd say, no. I'm filling this up, making the same amount of money, just as much as when I used to just have a bunch of, chips and stuff in here. All right. So why don't we take that and extrapolate that out? All right. We have to find better ways to access health care and make it as an investment. And I'll give you one example with this, Happy. Our government right now has been, and not just this government, successive governments.
Yeah.
Got Paho in their ear talking about, y'all need to make sure that y'all register all these products from these companies because all these counterfeit drugs. All right. Let me be clear about this, man. All right. I chaired the Counterfeit Drug Task Force for 9 years for the Organization of American States. That's all of Latin America, Canada, all of the Caribbean, including the Bahamas and the United States. Do you know which country has the most counterfeit drugs?
USA.
The US. And they don't allow you to import no drugs in like that. They require that the drug has to be registered in their country before you can bring it in. So you can't just pop up and send stuff in. It has to be assessed and registered by the FDA. All right? All right? But you know what's the second largest ones? South American countries. Put the producers. Brazil, Argentina. All right? The Central American countries. Nicaragua, Venezuela, Panama. You know why? Because nobody is trying to send counterfeit drugs to the Bahamas. We're too small. Ain't no money in it. And over 82% of the drugs purchased in this country are purchased or dispensed through a public facility. All right? So a single buyer is looking at all of this stuff.
Right.
And I can tell you, in the government system, we had standards that you have to have WHO approval and all these different things. You might get a batch of something that's not good because that batch isn't good. Every company does that. There's always recalls, but you wouldn't get no counterfeit stuff. But they tell us this because they want us to stick with buying stuff that comes from these big branded companies. Because these big branded companies, all right, are in this group called FEPHARMA, all right, International Federation of Pharmacy Manufacturers. The Spanish version comes out to the acronym FEPHARMA. FEPHARMA sits as a member of the Pan American Health Organization. So in a grouping that's supposed to be countries, a manufacturers group is sitting there. They fund and subsidize PAHO. So of course PAHO wants to turn around and tell us in the Caribbean, who pay in US dollars, right? Y'all need to just only register them, all right? If the government goes with this, through this CARFA, the Caribbean Agency for Regulatory and Public Health Agency, it's based out of Trinidad. It's based in Trinidad, and Trinidad don't even use it for their meds, right? If the government goes along with this, drug cost will increase minimum 3 to 4 times. Easily. All right? Because when you remove all of the generic options out of the market and the brands ain't got nothing to worry about competing with, they can put their price wherever they want, and they have.
Yeah.
All right? So we're not looking at access to care. Because if we were, we would start looking at how do we go and talk to some of the biggest companies in the world to get better drugs here at lower pricing. We'd be talking to India, which makes 87% of medicines in the world, makes all the base product that they use to finish the manufacturing process in the US and in Britain and in all these other developed European countries. But we want to sit and listen to some folk with some Spanish accents and some curly hair because they got green eyes, and they tell our folk, yo, no, we don't. India bad. Right?
Yeah.
But India's making the base product for their product. All right? So when we're talking about health access to pharmaceutical care, it's not just, are there more pharmacies? Are there enough pharmacists? Cost drives everything. And if people can't afford it, and by people, I also mean the government. If the government can't afford it, then it's people who suffer. All right?
Yeah,
and ask your listeners this. Have you gone into a public pharmacy facility in the last 3 or 4 years and seen chronic shortages? Because if you ask them that, all through the pandemic, we never had no issues with shortages in public systems.
Medicine products. Okay.
Never. But all of a sudden now, what's happening? And even in the private sector, you're seeing it because there's this squeeze coming from, this isn't registered, or we need to get this, or we need to get that. Can't work.
Ooh. So when we look at all this now, where am I? From your experience as chief pharmacist, and you mentioned this now, across the public hospitals, where does pharmacies have the greatest untapped impact in our healthcare system? Because people only look at doctors as having an impact. They don't think the pharmacists have an impact. So where does it?
So I think there's two answers here. The first deals with within the hospital system, we need to expand the role of pharmacists in clinical practice. All right. Per capita, we have more doctors of pharmacy in this country than any Caribbean country. All right. We have the folk here. What we got to do is.
But are they across the whole Bahamas or just in Nassau?
No, not just in Nassau. We have them. We have doctors of pharmacy in this Bahamas who are in private sector working in community pharmacy.
Okay.
We have doctors of pharmacy, Bahamians, all across the U.S. I talk to them all the time. All right, who would love to come home. All right, but here's the thing: you can't pay them $60,000 when they're walking out of school with a $220,000 debt. Doesn't make sense. All right, you got to pay them what they're worth, and that may not be what they're making in the States. I'm not saying they're gonna make $130,000, $140,000, but you got to get that number up. All right, because every study that has been done across continents tells us that when pharmacists are involved in clinical care, when they're on those wards doing rounds with the doctors, when they're being able to be used as information centers, that medication errors are decreased, that the patient outcomes are much better, and that savings to the healthcare system, rack up into the 7 figures. And we haven't even touched litigation cost. So that's the first thing there. We have to get our pharmacists, our qualified clinical pharmacists, out of the pharmacy and onto the wards, working with the doctors and nurses as a complete healthcare team. And what you're going to find is iron sharpens iron. Those physicians are trained in diagnosis. They're trained to spot what the problems are. Okay? Those nurses are trained to provide care once they're given good instructions. The pharmacist is trained to say, if you know what the problem is, here's how we find the best possible combination of medications to fix it. All right. And not having that in our hospitals in a wide scale is a problem.
Yeah, I experienced that at MD Anderson. Unfortunately, I was there for reasons nobody wanted to be, but yeah.
I have a couple of my fraternity brothers who work at MD Anderson as pharmacists. They love it there because they're allowed to do what they've been trained to do. The second part of it is in the community. All right. What's untapped for us is we need to find ways to maximize pharmacist intervention at the community level. And we're not just talking about picking up on mistakes that might happen when people see doctors, right? I mean, nobody's perfect. We understand that's a part of it. But we're talking about things that creating avenues for pharmacists to give feedback when they get information that the patient isn't telling. All right? Because trust me, we do. Okay? Creating avenues and compensation for them to do monitoring, long-term monitoring of patients, particularly in chronic disease drugs, so that problems or inaccuracies in treatment or even drugs or medicine therapies that aren't being effective can be picked up much more quicker so that shifts in therapy can happen. All right. We need to find ways to monetize that, because if it ain't monetized, then it's not important. That's the world we live in. If it ain't making money, it's not important. All right. And we have to find ways to do that. A big way to do that, I think, is freeing up our pharmacists to do more of that, even in the retail system, by allowing our technicians to do some of the other things, training them to do some of these other things under the supervision of pharmacists. That's going to be critical for us. And to me, the public system should be leading this, because the public system can do this without having to have the impetus of this must make a profit. All right. We can do this in the public system and work out the kinks. And if it breaks even, we'll be okay. And that will help to build what's happening. All right.
Cool. So what misconceptions about pharmacy most limits how policymakers and the public value the profession?
I'm going to talk about the general public first. I think the general public doesn't understand just how much pharmacists know from being trained and even know from continuing education. We're required to do 20 hours of continuing education in this country just to keep a license, right? That's the same amount that the US does. All right. So we're up to that particular standard. All right. And at the end of the day, all of our system here is actually up to, our credits here are based on the system used at the Pharmacy Council of Jamaica, which again is based on what's happening at the American Pharmacy Association. So we're using global standards for continuing education. We have a system now where people have to have a degree to come into the program. So we're getting really qualified, smart people. All right. And the biggest misconception is, I'm not going to ask this question because they probably don't know. The truth is they probably do know, and you need to ask that question. People underestimate their pharmacy and their pharmacists. For the policymakers, their misconception is that they think pharmacists make too much money. They believe that pharmacists make so much money, and all they see is, well, they're making all the money just for reading what the physician do and putting the label on it. They don't understand what we do. They don't understand the amount of work that has to go in, checking and double checking a patient's profile, making sure, sometimes calling a physician and saying, do you know that this patient is also on this and you need to adjust this dose or change this drug? They don't understand the level of everything that goes into the amount of steps before that patient gets that bottle with that label on it. And they don't understand how thin the margins are. Because unlike every other business in this country, you can't have a sale on prescription medications. You can't be like, hey, I got some antibiotics. This must go, 3 for $5. It don't work that way. All right? You and as a pharmacist, my owners tell me this all the time. I have to keep this stock, doc, because the minute that person comes in and I don't have it, they're leaving with a negative connotation about my store, a negative feeling. And once they go somewhere else and they have it, the next time they need it, they're going to say, well, why am I going there? This person has it. So there's this pressure to keep stock. And you have no way to get rid of it if it don't move. And I can tell you this. I'll give you an example. When I sat as acting director for the Bahamas National Drug Agency, which at that time was the procurement agency for all of the public sector, we had a year, I want to say it was 2014, 2015, where there was a scabies outbreak just rampant through the country. Like it never left. It started in September and it was going straight through till June. All right. And scabies is normally a cold weather thing. Okay. We used more permethrin in that 1 8-month period than we had used total in almost 10 years.
Wow.
Okay. Now, nobody could tell us why this was happening. All we just know that public school, private school, island school, Nassau school, everybody was having scabies. All right. And just as easy as it started, the next year came, we was like, well, we got a budget for this. And I was like, okay, let's be conservative. We can't budget for what we spent last year. Let's at least do it for 50%. You know what happened? We didn't even use that much. All right. And at the end of the day, if we didn't get good dates on it, those things would expire on us.
Right.
So policymakers, and that's in the public sector. Now imagine the private pharmacy does that for every product they run.
Right.
And these policymakers think that we making all this money and we just getting an easy job and it's easy money, so we are prime the tax. And you have seen this particular administration. Let me talk to this. This particular administration, okay? In particular, the Minister of State for Finance and the Financial Secretary target pharmacies. They've done that. They've targeted us with price control. They've targeted us with changing systems and rates, and they just willy-nilly, because they just think this is no big deal.
Yeah. So it's an education process as a whole, and that's part of the mindset thing that I keep talking about, right? That the similar things happen with engineers. Everybody seem to, like I was saying, run a broadcaster today, right? That everybody could talk, so they think they could do broadcasting to the best, and so they could put anybody in any position, and it's going to be 100% efficient and focused and working and profitable and all that kind of stuff. That's not the case, right? And the same thing applies, but there are certain industries, like you said, that might be more critical in terms of, or sensitive in flaring up the fallout versus the other things, right? And so those are things to work on too. So in the couple of minutes we get left, unless you could give me a couple more minutes so we could run through some of these a little quicker, but you've led both nationally and regionally. What leadership lessons from pharmacy translates best in nation building?
And I've learned this at every single stage, from student government at Bahamas Academy to student government and club leadership at COB to fraternity to church to lodge to Rotary, whatever. People respect your work more than they respect your papers. All right? People want leaders who can give them vision and motivate them, and then get there with them and help them do the work. I'm telling you this. My staff will tell you this. Anybody who's worked with me, I come out and that line is long, whether it was at Duran or PMH, whatever else, and I got my bow tie on and my cufflinks and my jacket. I take that jacket off. I take them cufflinks off. I roll up my sleeves, and I'm checking or I'm filling. I'm doing whatever. I'm not going to do that until that line reduces.
Mm-hmm.
Okay? When I was in Grand Bahama, I was chief pharmacist. But you knew who had to go to the boat and pick up the meds and sling boxes? It was me. So I had a staff full of women and one 68-year-old man. So who you think was lifting the box? So every Friday, because the boat coming Thursday, every Friday, I in the back of the hospital in t-shirt and jeans, and I had to tote boxes and lift and check, right? But what it did was it taught me what everybody that I'm trying to lead is doing. So people can come to me as a leader and say, hey, this is what you don't understand about this, because I work in the trenches, I understand. And two, it gave me an ability to see what could be better. How could we make things better? All right. But more importantly, thirdly, when I came to my staff with ideas, even if they didn't believe in the idea, they'd say, Dr. Smith, I ain't not gonna wait. That sounds crazy. But if you say let's do it, because sometimes people need to believe in you more than they believe in an idea. All right. That's the problem we have in our leadership across the board. Where are our ideas? Where are our ideas? All right. We got I just came from Freeport last week. We got a whole hotel sitting there that we don't even know who own it yet.
Yeah, well, that's a different cattle animal altogether.
Okay. The government never fixed the dump problem until they gave it to the private sector. Now all of a sudden, you ain't got no dump fire every other week.
Yeah, but you know, we used to always talk about the government. The government isn't going to fix anything like those type of things that you're talking about there, because they are remit for what they have to focus on and stuff like that, in all fairness. Really, there's no continuity that can really happen to cause things to happen unless they focus on one or two things through the whole 5-year, 10-year. I'm talking about major things. I mean, not about the mindset. And focus on those to fix, because it takes about 3 years or so in the government systems to get anything materially done. So you can't do everything in that space of time, right?
I think that's an issue that we have to really talk about.
I agree.
I don't believe it takes 2 to 3 years, because I've seen us, when we're motivated to do stuff. Now let me tell you this.
Yeah, but my question, my thing to that is, how much stuff could you do when we motivated to shortcut and advancing? That's the part, right? Yes, if you become more digitally connected and stuff like that, then that's going to smooth a lot of. I understand all that. Trust me, being a digital
our issue is
inventor and stuff like that, I understand all those things. And efficiency is a major challenge that we have. But our bigger challenge is the leadership mindset.
So this is a leadership legacy problem in this country.
Yeah.
Okay? A leadership legacy problem. No matter who's the leader, they've got the same mentality, and so this has now become the legacy. Our dysfunctionality ends up being somebody else's profitability.
Yeah.
Okay.
Yes.
And so a lot of the things that are broken in this country are not broken because they have design flaws. They are operating exactly as they've been designed. They've been designed to create dysfunction or maintain dysfunction so that somebody else becomes profitable about it. And that's a problem we have.
You have some of that. It might be plenty, right?
And I'll say this to you.
Mm-hmm.
If we keep taking our best and brightest minds and putting them in the corner and saying, you be a technocrat, you be this, you be that.
Mm-hmm.
And the only way, I go back to this issue where we're in our mindset, the political.
So look at the question on the screen while you answer this.
I'm looking at it.
Yeah.
Right.
Mm-hmm.
What happens is we keep getting trash leaders because we just keep picking out the garbage. If you're picking out the garbage, you're gonna get trash. Okay. And so none of these folk who sit in these positions end up making any real change, because the truth of the matter is they aren't the people gifted, equipped, or even motivated to do it. But that's a whole different discussion.
But you might say, but the majority of people who in positions of authority or have titles and stuff like that aren't real leaders. Right?
No.
So real leaders are leading people, not pushing or forcing or bullying.
And you know how you know it? You know how you know it? Because every 5 years we vote them out, right? And every 5 years, very few of them ever get picked up in the private sector. The private sector never says, hey, you've been the Minister of State for Finance, blah, 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 blah. Let me help you. Since you've been running the country's finance for billions of dollars, come run my multi-million-dollar company.
Like the people that say my minister can run out. So what because you can tell me you got to go, right? I could stay for another half an hour. Right? You got plenty of questions that people ask me to ask you.
Okay.
So
I'm here for
what advice would you give young people, young Bahamian pharmacists who want more than a job and seeking purpose, influence, and sustainability?
The Bahamas is a great place for you to practice as a pharmacist. And I tell every young Bahamian, when I start to tell some of these old pharmacists, start giving service. All right? Understand that what you're selling is not a product as much as it is a feeling. All right? Create that confidence, that product confidence in who you are and what you do, and people will find you. They'll drive across the island to your store. They'll come to your clinic. We see this all the time, Once you get somebody convinced that Apple is great, you can never get them to change to Samsung, and vice versa.
Yep.
Okay. And Tim said it best. He said, we don't sell phones, we sell a feeling.
Yeah.
That's why people used to camp out for a week to go get their new iPhone.
Experience, yeah.
Okay. You got to sell a feeling. And so what are you giving to them other than product? All right. So if you're seeking purpose, your purpose has to be, how do I get my customers, my patients to be healthier? How do I make them feel like every time they step in my store, the best part of their healthcare journey is about to start? All right. How do you influence? First, you can't influence if you don't have the information. So stay on top of what's happening. Make sure that when they hear something about a medicine, they hear it first from you. Okay? Create avenues for dialogue. All right? If the only time somebody talks to you is when you say, hey, this is your stuff, you can read the label, you good? All right, go home. Then you're not giving them anything. And that produces sustainability. That produces not just sustainability, it produces a satisfaction. People ask me why did I stay? Why have I been in the public sector for 20 years? I mean, obviously I've had job offers both here and abroad. I get job offers every week, right? My LinkedIn blows up every day. Why have I stayed in the public sector? Because I believe that if I could get it right for Miss Sue, who in Auckland's, all right, then that gives my life purpose. All right. And so I'll give you a quick story. When Dr. Greta Eunice-Carey came to us and said, we have too many people who are experiencing dementia and Alzheimer's in this country. We need to find a way to treat this. We said, but there's no cure for it. She says, no, but if we can get the drugs, slow it down, we can give that person an extra 3-4 years. We can give that family an extra 3-4 years. And for them, it's a lifetime. I went to the formulary committee and I fought for that. And a bunch of physicians and bureaucrats and number crunchers said, that don't make no sense. Right? But I fought for it. And we got it on. You know what happened 3 years later? My grandmother ended up with Alzheimer's. All right? And then my other grandmother ended up with Alzheimer's. And that 3 or 4 extra years became 3 or 4 extra years for me.
Right.
All right? And that's what drives me to stay into the public. That's what gives me my sustainability. It ain't these politicians I work for. Trust me. If it was for them, I'd pack up and go a long time.
The key out of all of that is the why, right? And I always tell people the same reason is why when I came home in 86 and built out the communications environment that we have today, which hasn't really changed since myself and Antonio Stubbs left in 2014. But that's a different animal altogether. But the whole idea was that the Penn administration encouraged us, and we haven't really had since any significant encouragement from governments and the private sector for people to come home, right, and work. When I say significant, I'm talking about the whole package, right,
I
where
agree
you
with you.
could
I
feel
agree with you.
comfortable and know that you'll be able to provide for your family and blah 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 and all that kind of stuff. Right?
I've said this. I've said this before, right? The only election I ever could vote in that Pittman was around was '92, right? But I'll tell you this: I don't I don't know that we've had a real prime minister since, and I'm not aligned to any political party, but in terms of someone who could speak to 1,000 people and make you feel like he was talking to you, okay? I had a unique experience with the prime minister, and a couple of unique back in those days because of some family connections and just being in different organizations that he would speak to, and he would say to me, "Young man, you know, you call me Young Burroughs because my uncle Gerard was his bodyguard."
Okay.
Yes, right. So you knew me, right? He said, "Young Burroughs."
Yeah, you all even look alike.
Of course, you can't hide the Burroughs now, okay? And he said, "Young Burroughs," right? And he'd say, how's it going? What grade you in? I'm this so-and-so. How you doing? How your BJC is so-and-so? All right. Next time I'd see him, he'd be like, how your GC is. Next time I'd see him, he'd say, I understand that you in COB. I don't know how he knew this.
Right.
Okay. But he would find a way, and he keeps saying, now, whatever you do, whatever you decide to do, you got to come back home. You got to build this country of yours.
Yep.
Okay. Yep. I came home. I don't know that I've ever been encouraged to stay home like anybody that sat in the prime minister's chair. Ever. I've had to find ways to motivate myself because I'm a nationalist. Okay, but the leadership is critical. And when we talk about this question about how we as associations evolve, you got to evolve from your leadership. Your leadership has to be able to get your members to move to action. That's what the word motivation means, you know, moving people to action. Right? One of the things I'm very proud of my association is I've seen them grow. When I was president in 2010 to 2012, that's when they brought up the National Prescription Drug Program. And we said we were going to stick together and so and so. And a couple of pharmacies went right ahead and signed under the table with the government. So the government came back and said, well, you know, y'all say all together, but we got these people already signed. And it really was one of the reasons why I was like, I'm not running again. Right? Yeah. Why am I wasting my time fighting with these people? And they just go, I turn around in the alley and I buy myself. Right? This time, okay, when we came together, we said, we're going to stick together. And we stuck together. Those that said they were going to stick, stuck together. Now, the ones who were flaky and flimsy, they're going to do what they want to do. When we decided to form this union, I went to my executive over a year ago, and I said, I need you to give me permission to start exploring putting together a union because that's the only way we can legally deal with some issues. I said, and if I hear it anywhere else, it could only come from you all because you are the only people I'm telling. I never heard that on the street. When I announced that to the body, the rest of the body was shocked, but the executive knew. All right? We stuck together. And even through the intimidation that we're getting now through price control and some of the other things, they're still sticking together. I just came back from Grand Bahama where I met with my members and some owners, and some of the owners that couldn't come out in the meeting at night called me the next day, and they walk in their office. They said, we with you. We got your back. We here. And so leadership has to be able to always remember you serve the interests of the people you lead. I don't own a pharmacy, Dale. I have no interest or shares in any pharmacy. All right. But I fight for every pharmacy owner as if I own all of the pharmacies.
Right.
All right. And people believe, again, when people believe in your work, they'll believe in your work.
Yeah, Maya Angelou always talks about it. You know, people will forget what you say or do, but they won't forget how you make them feel that you have their best interests at heart, etc. And all that kind of stuff.
Exactly.
So, folks, you're watching Something to Think About with Dale Happy Knowles, and if you have any questions, do please drop them on this fellow because 24 hours in the day he can be doing something, and he mightn't stick around long enough for you to ask the question that you want to ask, right? So So how can pharmacies contribute to more directly to the economic resilience and wealth of this nation?
So let's just take the
Pharmacists, I
average
should say.
pharmacy.
Yeah.
Let's take the average. The average pharmacy means I have to have, first of all, the law says I have to have a pharmacist. So I'm hiring a pharmacist, or I'm the pharmacy owner who's the pharmacist, right? I have staff. I'm buying stock. So I'm creating an economic.
Now, when I say pharmacy, I'm referring not just the building structure,
No,
office
I'm
where people
coming to
come
that.
into.
I'm coming to that.
Okay.
I'm going to build this out. Okay. And as I continue to contribute to healthy people, I'm empowering them to go out and work and generate the economy.
Okay.
Okay. I'm owning my own business. All right. Which allows me to take that money and put it where I want to. That creates more and more wealth, and creating something I can pass down to my children and their children. That's creating generational wealth. Because pharmacy is practically a recession-proof business, as long as people get sick, they need meds.
Right.
You're talking about something that's inherently and intrinsically resilient. All right. Now you take 100 of those and put those together, and they start working and moving together. All right. They start buying together. They start creating avenues as a collective, understanding that, hey, for us to continue this, we need people to go to school. So we're going to invest in students to go to school. We're going to invest in places for them to train. We're going to invest in helping our patients to become more educated. Also, all of this now creates a Bahamas, or contributes to creating a Bahamas in which you have productive citizens engaged in a industry that is essential, creating generational paths for economic stability. All right. That's, I mean, if you want something, you can tell me anything that's more nation building than that. All right.
Yeah.
And this is the thing that we watch others do, man. We've watched others come to this country and do this in so many other areas. The only thing that save pharmacy is the thing that you can't have a foreign owner pharmacy.
I was just going to ask you that if because there's the same, like it's only doctors and lawyers that you have these protections in, right? And maybe fisheries, yeah.
Here's the thing. And here's why you don't want foreigners owning any healthcare in your country.
Or any essential services, but that's another story.
Yeah. All right. There's a component of healthcare, and I call it, some people call it some other things. I call it cultural competency. You have to know the people you're treating. You have to know how they engage in their lifestyle. You have to understand that when the person tell you, no, I don't really drink, or I don't smoke, you need to say to them, no, I don't smoke, doctor. I don't really smoke. Once they say I don't really smoke, you know what that means. I mean, when I have a couple of Heinekens, I might have a cigarette or two, or a cigar. People don't regard cigars as smoking, right? So you have, you see, there's a cultural competency to that. Okay, you got to be able to talk to people, engage them. You got to know. My grandfather always used to say, you got to know the story, the his story, and the mystery. All right, and that gives you the truth. All right, so you know, these are the things that we have to be able to do. All right, and you don't get that. And so don't mind the people talk, but they want to build a hospital and bring in 300 Chinese doctors or do whatever, so and so. It's not going to work to treat our people. Their cultural identity on who they are and how they view life, how they view the concept of health is different.
Yeah.
Completely different.
So I mean that's a challenge across the board, because we know we need volume, because back in 88 or thereabouts, I went to USTTI, which is a US government pretty much funded program in communications, and it's sort of like a Silicon Skills and all them type of things, but more modern kind of thing. And this professor, when he realized that I was from the Bahamas and we were talking about sustainability in communications and so forth, he went in his office and pulled a report, and just to fast track it. Basically, what the report said in a nutshell is that for the Bahamas to be sustainable, economically sustainable, we had to have at least 3 million participants in the economy. Otherwise, the volume would be too small for our land mass and stuff like that, based on what they studied, right? And I said to somebody the other day, well, I always be mindful of that. The only businesses in the Bahamas that really are structurally sound are those that leverage those millions of people that come to the Bahamas in some which way or form.
And we own none of them.
Huh?
We own none of them.
Yeah. I
And we
mean,
ain't getting allowed to own none of them.
but you
right?
leverage you leverage them too in pharmacy, because they have to come to you. They
We
can't.
could. Listen,
Yeah.
we have
You
some
might
of the,
not leverage this as much as you could, but you still do. Yeah.
but what I'm saying is we could, even the government could. Do you realize that our drug costs per capita are the lowest in the region? Not the Caribbean region, pretty much the Americas,
Okay.
Central and South America. We're the lowest.
Mm-hmm.
We make nothing, but somehow we're able to access product. And here's why. Because for anybody who wants to send that product from south to north, or from north to south, or from east to west, or from west to east, it gotta come through us. It gotta come through us. All right? I can tell you, I did procurement for the government for 22 years. All right? And I know fool. When I would see what we buying for stuff, I call my colleague in Barbados, hey, tell me what y'all getting for this. Call the one in Jamaica. I go get the documents. We were always the lowest, even though our population was small. For two reasons. One, we pay in US dollars, and we used to pay on time.
Right. Okay.
Okay? Now the understanding is we ain't paying too much on time no more, right? But if we paying at all, but these are things we have to do to create this environment. All right. And if we do that, we can then take those numbers, extrapolate those, and say to tourists when they come off here, listen, if you bring us a prescription, you could, and the whole thing is this: you don't even need for them to bring it. You can set up things where they send it. These are prescriptions they're already on. It's just called transferring a prescription.
Right.
And you can say to them, have your prescriptions transferred to our clinics here. Have the doctors write them because it has to be a doctor registered and licensed in the Bahamas. And we can fill them here, even at the public facilities. And people could come off the cruise and we have their stuff pre-filled, and they come there and they pick it up and they pay for it, and we clean it up. Cleaning up. All right. All right. I when I was in Grand Bahama in 2001, I made, for the first time ever, a public pharmacy made a profit. You know why I made it? I looked at all of the medicines that we didn't carry, that the private sector carried. And then I went to the folk. I said, listen, can we buy these and bring them in and sell them cash only? Not even insurance, cash only. Okay? And in 2001, if you were buying Viagra in Freeport, Grand Bahama, you were getting it from the Rand. Because we could get it for you cheaper than anybody else.
Right.
All right? And we were creating profits for government facilities. Never heard from before. All right? So this goes back to the question about how we could contribute to not just economic resilience, but wealth creation, even for the public sector.
Right.
So,
but we seem to have a struggle when we talk about wealth creation. If we talk about general through the big system and not individually, right? Because we only correlate what is individual and so forth. In terms of when we talk about wealth, we talk about building wealth, and you mentioned a number of things that causes wealth to be built in the Bahamas. But because we might not say how it affected me directly, then most Bahamians dismiss it as not building wealth.
I looked at one of your things here, and I will say this. This is why it's important to have Bahamian leadership at Bahamian institutions. All right? Let's go to the cannabis discussion that was crazy for the last 2 years. And the association had to fight and agitate to get the government to change the act into making it a medicinal and research bill.
Right.
Do you know who should have been at the forefront supporting that and blasting that out and educating the people about why the research part of this was critical? University of the Bahamas.
Yeah. Yeah.
But you got a paid mercenary as president, this foreigner who don't care. I'm here for a contract. When my contract is up, either I get it renewed or I go back to DC because that's where he's from.
Mm-hmm.
Okay? His children ain't here. His navel string ain't here. He has zero real, he got no skin in the game.
Right. Yeah.
Now, if you had a university president from the Bahamas who understood, I can make my legacy of this, but more importantly, I could do something to change for generations. We could start our own cannabis research facility here and have drug companies come and pay to do their research here because the Bahamian strain of cannabis is going to be something specific. We're going to patent this. Anybody that wants to use this is going to have to come through us. And we could put in 10 to $20 million worth of grants every year just off cannabis. And don't think I throw those numbers out lightly. In your introduction to me, you said I sit on the Dean's Advisory Board for the College of Pharmacy. College of Pharmacy at Mercer has over $100 million worth in research grants. Okay? And they ain't started to touch cannabis yet because Georgia law won't allow it.
Wow. Wow.
Okay? So $20 million a year is peanuts. But what could $20 million do to transform University of the Bahamas? Think about that.
Yep. Yep.
Okay? So when we're talking about natural wealth, when we're talking about light industry and food security, when we're talking about sustainable initiatives, when we're talking about even digitalization, getting these processes and doing the research for cannabis using AI. So instead of having to run actual in vivo experiments, and for those of you who know, that means actual live experiments on all these different samples, you take it and you run it through a digitalization scenario on AI, and AI could run 10,000 of those in 10 minutes, right? And narrow down what your good ones, possibilities, what your bad, what your not successful ones are going to be, all right? All of these 5 pillars can be impacted by that, but you're never going to have anybody who doesn't have a stake in this country, a real stake in this country, leading an institution that says do this, unless some money going directly in their pocket. And so we continue to allow one politician to bring in paid mercenaries to lead our educational institution in the country, and then wonder why, 1, kids don't want to go, and 2, you're not seeing this institution develop and blossom and grow like it should. Because the fellas who leading it ain't got no skin in the game. And the people who picking them don't never send their children to public education. They got a bunch of boarding school babies and private school babies. Ain't none of their kids went to COB. I've been to COB. All right? My nieces go to UB. I got some stake in the game. But I can't, who am I going to talk to when the leadership don't even understand basic Bahamian culture? All right? And so that's the key for us. That's key for us. And how does that impact pharmacy? We should have had a pharmacy school at UB 10 years ago. How is it that Bahamas Baptist College has a pharmacy school and the University of the Bahamas don't have one? Does that make any sense? I congratulate BBUC on what they're doing, but they don't have anywhere near the resources that UB has. And if they can see a need to do it, certainly UB should have had it by now. And we've done, as an association, all we could to push and get that done, but the powers that be don't want it. And don't make a difference whether the powers that be turn out to wear gold and or red. Nobody cares. Nobody cares. So, I don't know. These are the
Good.
things that frustrate us, my generation, Generation X, who, we see these things as just common sense, and we can't understand why the older generation steadily puts their foot down on it, and the younger generation just don't seem to believe that any of this stuff is important. So,
Well, that's part of the challenge that we have as a nation. Moving through the generations. President Lincoln, I think before he was president, he said the philosophy in the schoolroom in one generation will be the philosophy in government in the next. Well, we haven't lived up to that at all because we're still in the generation, the philosophy as to the majority rule movement philosophy. We're still in that in our political environment,
Dale,
which is
you
unfortunate.
know the three most dangerous words I've ever heard in the public sector in any meeting? You want to know what those three most dangerous words are?
What's that?
The government high. Anytime I go into a meeting and someone tells me I went to the government high, I look at them and I go, "You too old to be in this meeting. You shouldn't be here. You clearly don't belong in this conversation unless we get a history lesson."
Right.
All right.
Sometimes you need a history.
Yes, but the problem is you should have given that to me a long time ago. You can't give it to me now when we're in the middle of talking about how do we digitize pharmacy. Listen, when I first came home, do you understand that people were in the public sector? They were hand writing labels and putting them onto boxes and bags. Hand writing labels. In 2000, when I entered COB in 1990 and would volunteer at private pharmacies, they had label printers. And I came back home and they were hand writing labels. Then you wonder why you have so much medication errors? Because if I couldn't read the doctor's writing to begin with, now I can't, the person who I send the medicine to can't read it, whether they're on the ward or whether it's the patient at home. And when I went to meetings and said to them, we have to digitize, we have to computerize, these programs aren't expensive, we just have to invest in it. They looked at me like I had 7 heads. But then I had to say to them, do you understand how quicker you could move stuff? How much more patients you could see? And how much more efficiency you could get out of your pharmacist if you put this in? And then they realized, okay, that made sense. And the leaders then said, okay, let's go ahead and do it. The leaders in the PHA.
Yeah.
It still took years for the Department of Public Health to get it because they came directly under the ministry. We have to find ways that we're always moving ahead. And I'll take, one of my really good friends is from Hawaii. And he always teases me because he says, y'all got better beaches, but that don't make me no difference because I don't like to swim. I like to surf. And you can't surf in the Bahamas, right? And he always would say this to me. He would say, do you know how you surf? You don't ride the wave. You figure out where the front of the wave is. And that's where you put your surfboard. And if you could figure out where the front of that wave's inertia is, right? No matter what's going on above you, that waves could be curling over and over and over and moving and moving. You're going to always keep moving forward, moving through the wave, and that wave will take you straight to shore because you stay right in front of it. The only way for us as a country, and particularly in pharmacy, to stay successful is we got to find out where the front of that wave is and move it. And digitalization, the incorporation of AI. I'm doing a program right now, learning about some stuff with AI, utilizing new ways to interact and integrate patients into their own healthcare. Those are the things that are going to create that wave that carries pharmacy for this country to shore. All right. And so we have to look at the digital platforms. We have to look at how we not just getting smart with digital stuff, but how do we create avenues for our patients when they come to our pharmacies to interact on a digital basis and not just WhatsApping, I need my refill,
Yeah.
but giving them information and interacting with them. All right. Those are important things. All right. So, I mean, for me, what regulatory shifts I would make, the first thing is I would make digitalization the floor and not the ceiling. All right. I would say to every pharmacy in this country, you have to digitize. You have to get connected. You have to get connected. And then that means the government has to be ready. If you want people to be able to report adverse drug reactions or maybe the suspect products, you need to have a system that when I can click and send it, you can give me feedback right away. Not tell me I got to fill out a form and bring it to the ministry or go on some tab thing and hope and then press send and then you don't respond back to me for
and this is what I was talking about in terms of governments having to pick the focus on certain things, right? Digitalization versus digitizing, right? Investments in digital, where you're going to have a transformational type impact, has 1,000 times, according to the World Bank and the ITU, return on investment than brick and mortar. We in this country have, granted the networks might not be to the level that they used to be or whatever it is, but they have the potential to be there overnight if we wanted to be back at premium. But we are connected by more than any other country in this region, including the United States and Canada, per square mile of country. And so if you consider that, and now you start developing or investing on top of that, right? Make that platform, that foundation super solid, and then invest on top of that. You know what kind of catapulting of our economy size could happen overnight. And so when you have your pharmacies working on top of that, or your pharmacy in terms of not just the building, like I say, the whole system working on top of that. Because healthcare and education, they tell me, are the two biggest cost centers in the Bahamas. And I don't see why they have to be cost centers. They can very well be profit centers. But we just need to get all of the clutter out of the systems. What's your comment on that?
Here's the issue, Dale. Number one, every time they write a law that deals with e-commerce or digitalization, any of that stuff, they're not writing it for us. They're writing it because some white foreign company who wants to come and set up here wants to be able to get around certain things. And so they send this thing, and all of a sudden that gets into Parliament before it took them 2 weeks to pass some of these banking and e-commerce laws. It took them 7 years to pass Marco's law.
Yeah.
Okay, a child alert law, something that everybody could agree on. Okay, again, our folk don't work for us. They create the dysfunction to give somebody else profitability. And so here's the thing. Yes, our systems ain't perfect, but I bet you if I send one video out, okay, you either toting some cut up from somebody or giving some cut up to somebody, I bet you it'll get around the Bahamas in 20 seconds.
22 far, too long.
Okay, so we have these things. Why are we not utilizing these tools? These guys will take the same tools that they want to run campaigns with, but won't use those tools to run health campaigns with.
Yeah, okay? I think you said it earlier where you said that, okay, you have skills or skilled people in certain disciplines that they're not knowledgeable about, and instead they lean on those people to help them. They just go off with the knowledge base, the inventory that they have on the thing, and then they listen to the foreign persons and so forth who could give them some sort of comfort of having a return, whether it's through government or through other means.
Listen,
To them, and that's our
we saw
system.
this. We
Yeah.
saw this play out with that big, huge fiasco with the cryptocurrency guy that came over here in short pants, flip flops, and a t-shirt.
Yeah.
Okay.
Yeah, but it's plenty of smoke screening in that too that caused the confusion. And and I'll give you a prime example, right? There's this voice note of a lady who is supposed to be highly positioned in what you call the thing now, asylum type to do, right? And I think it's on one or two media persons pages and stuff like that. Well, I asked the question after listening to it about 3 or 4 times, is that people talking about what the government this, the government do that. And I said, first of all, the government is people. We put them there, and we flawed, they flawed. So we have to find a way to get rid of the flaws and work on the parts and focus the attention to people who, for certain functions that are not flawed. Because you can't ask me to be a pharmacist, right? You can get crap. So I know what I know, you know what you know, and so you need to lean on the right people for the thing that you're dealing with. I don't expect you to know everything I know about communications, right?
Correct.
You might know, you might be a super brain like that. I don't know, right? But the point is that it's teamwork, and we seem to be a country with highly skilled in teams sports don't understand teamwork in work and economy and how in order to cause us all to get to higher levels of stuff like that. And so as we look at this question on the screen, we say, looking ahead in 2026 and beyond, what does success look like in the Bahamas Pharmaceutical Association and for healthcare broadly?
So let me take the association first. I think the first thing that success looks like for us is getting the approval and rolling out of our new pharmaceutical union. That's critical. All right. The only way that any government successfully pulls off improvements, real improvements for the Bahamian people, and not just the folk who could afford to go to them other places who's advertised on the radio and TV. Okay.
Right. Mm-hmm.
Is through a real public-private initiative, a partnership that works for both sides. All right? That has to be negotiated. All right? And legally, it needs to be negotiated through an entity which can provide leverage.
Mm-hmm.
No negotiation is successful on either side without leverage. Mm-hmm. Because if you don't have leverage and you get me to acquiesce to do something, right, because I have no power. All I'm trying to do for the rest of the time is figure out how to get from under your thumb.
Yeah.
Okay.
Okay. I'll get something from you. Yeah.
Okay.
Not a plantation situation.
We have to have that in place, and that's why we were so adamant with some of the things that happened with the Office of the Trade Registrar, for trade unions, because we know that there are people who do not want this union to happen. Some within our sector, some within the general healthcare sector, and some in government. Mm-hmm. We understand that. And we understand the pressure that was being put forward. Okay? But like I always tell folk, and you know this from a place that we share, the only way to abolish darkness is to shine light. Mm-hmm. Mm-hmm. Right? So I've said this to every minister that I have had a chance to represent the association with. If you tell me something, I can tell my members. Okay? And if I tell you something, I can tell my members I tell you something. Mm-hmm. All right? I don't believe in darkness. Only thing good dark is my skin. All right? So other than that, I can be straight up and transparent. As long as I'm leading, that's the way we move. Okay, same thing I tell my members. Don't bring your political affiliations and all these other things here. When we talk pharmacy, we can talk what's best for pharmacy. Okay? And I've tried to encourage them, listen, you have to make decisions based on the fact that you are an owner. This is your business. All right. And if that makes you a one issue voter, then that make you a one issue voter. But you have to, your mentality when you do these things has to do that way. And I think the union's going to be critical for that. The other part of it is we need, as an association, as a professional, to continue to advocate and push the government to do certain things. We need a national pharmacy technician exam here, so that local programs can have a set template to know this is what we should be teaching Bahamian technicians to practice pharmacy in the Bahamas. We have a national pharmacist exam that we were doing, and we're working on some of the regulations to straighten that out. But we need a technician exam, because sending our people to go do a course online in the States is not helping them with that issue of cultural competency we talked about. Okay? So we need to agitate for that. We need to get the medical cannabis program up and running properly for the patients who need it, and be the guardrail against abuse and disuse for those that don't. All right? To me, those are the things that look like success. And then lastly, I wrote the Constitution, the original Constitution, the association that functioned for almost 30 plus years without a real Constitution, right? And in 2005, then President Elfrida Starr asked me to put together a Constitution, and I wrote that Constitution. I wrote it never thinking I would ever be president. I just wanted to help and write and be done, right? And one of the things I put in was term limits, right? And so, in 2005, I was in my 30s. And so 30-something-year-old me is saving 50-something-year-old me, because I wrote that you cannot be president for more than 2 terms, period. Not 2 consecutive, 2 terms, that's it. Right. What that has done is that has spawned a creation of new leaders. And we've always been able to find a new leader because people realize that there's a space for them to grow and to be leader. No one's here forever. Right. When I did my first term, I said to them, the late Stefan Flowers was my vice. I said, Stefan's ready now. Let him go now. They said, but you have another term. I said, let's keep this in our back pocket, because one day we might need this. Right. And we ended up needing it 2 years ago. Yep. So in March, I will demit office, and we will have a new president. I don't know who that's going to be. I'm not tipping my hand on the scale to pick nobody. The members will pick who they want. But I'm confident that for us, success means picking somebody who understands the fight, what the fight is, understands how they must fight, when to fight, all right? And is going in the fight to win. All right. So to me, that's what success for the association looks like. All right. For healthcare more broadly, man, we got to finish this A&E department at PMH. We got to stop having people sitting out in a hallway in the old tuck shop. That's not.
So let me throw some more at you right now, right? That.
Oh, and let me say this. I know this deal because I was a patient there last year. So I know the system. I had to be in it. Yeah. Okay? We got to do better. We had the greatest people in healthcare in the world working at our public systems. Trust me, you got some bad apples, yes, but you got some, not just skilled folk, but people who go above and beyond. I watch our nurses who's supposed to be off shift still there 2-3 hours later because they're making sure that this patient gets them. I watch my pharmacists stay over. I mean, I've watched people come in on their day off, come in and volunteer and do things. We have great workers. We got to figure out a way for management and the overall funding and all of these different components to come together to fix healthcare. Because you're not going to fix healthcare in this country by putting more private places, because most people can't afford it.
Right. Yeah. Well, right? You're looking at one, right? Because the first thing is the second part of that equation is insurance. So, but we ain't going on that road today.
Oh, listen, once the union come, insurance companies, I'm putting you on notice right now. Now, I'm stepping away for president of the association. but my presidency of the upcoming union is 3 years.
Okay.
Okay, I ain't going nowhere with that, and we're gonna take these insurance companies on.
Yeah.
All right, because at the end of the day, insurance companies should not dictate healthcare. They should not.
Yeah. So the question I had for you about the hospital situation is this: in Atlanta, they have what is it called, Grady Hospital,
Really, I trained
which
there.
is the trauma center. The hospital don't treat nothing else but trauma, as far
That's
as
right.
I know when I was
The
there.
Marcus Trauma Center, the #1 trauma center in the Southeast United States.
Right. Now, I didn't start off that way, right? So my question is this: you can build a new hospital for whatever specialized stuff you need, and yes, we have a bunch of stuff that we need specializing in. But I'm thinking the biggest one we have that we need specializing in is trauma. And I remember Dr. Influenza, when he used to be my neighbor, always say that he wanted to do this thing because this was a huge thing needed in the country. And that's like 90, 89, 90, when he was my neighbor.
Wow.
Can we build, or is there justification in making that a trauma center? And I'm not just talking about gunshot trauma, because there's all kind of trauma that could be happening, with mental health, this, that, or whatever.
Do we need to build out a more comprehensive trauma center? Yes. Do we need to turn a hospital into a trauma center? I don't see it. I don't see the population for it.
Fair enough.
And more importantly, keep in mind this. What we're doing right now is not so much a space issue because of the trauma cases. It's when you take that trauma case and you are able to make an intervention, like our wonderful doctors and nurses and pharmacists do, right?
But are we treating all trauma?
Even
if that building is finished at PMH, that segment is finished, that whatever quarter is finished, whatever you call it, I don't know how to classify it.
Right.
The new, will that cover all traumas? That
I think it can. I think
Okay.
it can. Now, if it does, will it do it? Is a
No.
question for management, right?
That's right.
But I
That's a
think it
different
can,
question.
and I know that we have the capacity
That's what I mean. The capacity to do it.
to staff that and make it work. I have seen PMH. I worked at PMH.
Mm-hmm.
When they brought me back to PMH, they asked me to come and take over again. My second stint as chief pharmacist there, because of some issues. In 2017, late 2017, we went and we revamped pharmacy care, but we just didn't revamp the pharmacy care. We worked with the other departments. I saw PMH rise to a level. And the fact of the matter is, when COVID came, PMH was ready. It was ready.
Mm-hmm.
Now, the ministry, they wasn't ready.
Yeah.
Okay? All right? The competent authority, I don't think that was ready either. But I can tell you who was ready. Our hospitals were ready. Even though they were packed to capacity, even though we had to have a tent clinic with Samaritan support, we found ways to make it work. Nobody got turned away. Like I said, we had no issue with stock and medicines. We found a way to make it work. And if we were not ready, you would have seen real havoc from COVID in this country. Okay? And that was not just the clinicians and the staff. That was the management. I gotta give Mary, who was the hospital administrator there, props. Because you know why? We understood that we couldn't lead from a computer.
Mm-hmm.
We put those masks on, we put those PPEs on, we went into those wards. We walked the halls, we sat down, we strategized. We had meetings at 11 o'clock in the morning and meetings at 11 o'clock at night.
Mm-hmm.
Okay? And we had a team there at PMH that really carried healthcare in this country. So nobody could tell me that the best healthcare in this country cannot come through a public system. I watched it happen when the rest of the world was struggling and crumbling. I watched it happen. I was a part of it. Okay? And we did so much more with so much less. All right?
Yeah.
So when people talk about, the public health care, I watched when public pharmacies at the clinics were talking about closing, that private pharmacy says, we will stay open. If we got to serve people in the parking lot, we're going to stay open. All right? They didn't do that because they was making money. They did it because that was their patients and they knew that they needed their stuff. Okay?
Yeah.
And so we found ways to make this thing work. All right? And so healthcare as a whole, we have the tools. What we need is the leadership. What we need is vision. What we need are people who are prepared to put real resources and prioritize accountability for those resources. All right? To make this thing work. I'm going to tell you what, as a Bahamian, let me tell you what I believe. Okay? What I think made Penland different from all these other prime ministers. Penland might have give you, Dale, the contract to do something because you Z boy or somebody say, well,
Yeah.
that's so-and-so, right? He can give you the contract. But you know what he can also do? He can make sure you finish that work. He can make sure you finish that work, right? Now, as politicians go, did you charge him $80 for a $40 job? Yeah, you might. Was there a possibility that maybe $20 of them ended up somewhere they shouldn't have went? Probably. But the job got done. Okay? What I've seen over and over again in healthcare in my 25 years working across the system is we get people who say they can do stuff. We pay people to do stuff. We hire this one and that one. I have seen a steady stream of consultants come in and out, in and out. But the real changes that happen don't happen through the consultants. They happen when people like Dr. Depute says, we're going to
You're
improve.
talking about foreign consultants or Bahamian consultants?
Of course, foreign, because we don't hire no Bahamian consultants, except for one do it. One 80-something-year-old does be the consultant all the time. You know what you're talking about, right? But I watched Dr. Depute say, we will fix maternity and go out and fundraise on his own with other physicians, and they got things fixed, right? I watch other physicians come in and do stuff. I watch the nurses create things and get the stuff done. I watch the oncologists come in and put together an oncology center. I watch the managing director, Mr. Brown, come in and say, hey, we're going to build this. We're going to make this happen. We're going to do this. We're going to change this. We came in, we computerized pharmacy. We connected the pharmacy system so that I could talk on the computer to Grand Bahama and figure out what they have in stock and move stuff back and forth. I've watched these things happen in the public sector. So with all due respect to all my private folk out there in private clinics and healthcare, I'm glad you're there for the folk who want to go there. But the fact of the matter is, Mama Sue can't go there. She can't afford it. She can't even afford to get in the parking lot. So we got to get our public systems in place to work because Mama Sue paying taxes.
Yeah.
You hit enough for VAT. You hit enough for everything. All right? She got a driver's license. You take the fee up every year. You do all these things. We have to improve the system for Mama Sue, whether she live in Nassau or whether she live in New Bycat Island. That is the purpose of that happening.
Yeah.
And that ain't political.
No.
It's
no.
nation
Well,
building.
I mean, political, not partisan. But anyway.
Yeah.
So, I'm glad that you took a couple of minutes extra because we're now bordering on 2 hours. People always tell me this show really should be a 2-hour show, but finding people to commit to 2 hours is another story. But we'll keep prodding and keep going. But we really want to thank you for sharing all of these stuff. And people, like I said, this is an energetic doctor. And you could hear from some of the things that he said that you have to be energetic. And I don't know if he take them big horse pill, but just give the horse and thing. But to have the energy. But
lemon and ginger tea.
wherever you see him, any time of the day, it always looks like he in gear number 4. moving fast, quick, and hurry.
You know that because, like I say, we sit in some places where
Yeah.
you got to move. Before I leave, I have to say this, man. Let me say thank you to my executive team. See, because the leader is the one who's in front, and I'm often the one on the camera. But let me tell you something. I have a hardworking executive team. I think I have 5 of the 8 living past presidents who still sit on the exec with me.
Wow.
Who have been president and still stick with us and work with us in different capacities. My executive secretary, Wendy, I mean, amazing, absolutely amazing. I want to thank my members because they support me. They stick with me. You don't understand how good it feels to know that when you go to them and say, what do you want? And they say, we want this. And you go and you put your neck out, that they got your back. They have my back. And I can tell you this because I can tell you media people have called me and said, boy, we call around and we try to get somebody to say something different. And they say, that's what the president say. That's what we say. Right? Yeah. So people have your back. And I think that's the thing that's allowed us to grow and really develop. And I want to thank my Caribbean colleagues who have allowed me, as stepping away from the presidency in 2021, to spend a little more time back with my own home association. They gave me a little bit of vacation, but now they tell me that as soon as this thing ends in March, I got to take over this other thing in April, right? But and I want to thank my family, man. I mean, you know, it's not just my blood family, but you know, my brothers, my Masonic brothers, my fraternal brothers. Those 2 groups of men, I can tell you, they keep me engaged. They keep me humble. They keep me hungry. They encourage me. And it's good when you walk out and somebody says, boy, we saw that what y'all did the other day and we appreciate that. And keep fighting, keep doing what you got to do. Keep working for the Bahamas. That's important. That's important, man. I don't want anybody to think I take those moments for granted. Dale, I get members who call me up and say, Doc, I only called to pray with you for 3 minutes. I don't even pray for you. I got friends who call me up and say, hey, you've been in my mind. I want to pray for you. That kind of stuff. I have friends who pop in and say, hey, take 2 minutes, stop by so-and-so. Let's sit down and have some food. You need to take a break. Right? These are the people that you know, I mean, they allow me to keep going. And I'm really grateful to God for having those sort of people in my life. That's so important.
That's awesome. So folks, that support system is key also. So you got a lot of nuggets. You try to push out a bunch of shots out of this and learn. And know that there's no barrier in getting it right. So Doc, we really, really, really thank you for taking your time out from your busy schedule, because I know that's another 24 hours, but you can take 2 hours less of your sleep time because you did this. I know how you go. Right?
That's mad.
You ain't shortchange nobody for whatever it is that they want. And we appreciate you for that and everything.
And all the best for the Christmas season and a happy and prosperous and productive 2026.
Awesome. And likewise, back to you and your family and friends and community. Peace. So thinking about what we learned tonight, that pharmacy ain't just about pills. It's about people, prevention, protection, and possibility. Since health is the foundation for productivity, and productivity is the foundation for wealth, then pharmacy has to have a seat at the nation building table. So the question now becomes, how do you shift from a mindset of cost managing sickness to one of investment intentionally building health? Pause. Think about it with intentional thought. Dr. Smith gave us much to consider and where to go. And as Ivan Bald says, knowledge is power, but enthusiasm pulls the switch. What you gonna do now? Tell us in the chat. I'm Dale Happy.
Enjoyed the show? Then subscribe to us for more educational and inspirational content. Ring the bell so you never miss a show. Let's change the narrative 242.